Good evening and welcome to Chaparral High School. In a moment you will be informed about eating disorders which include anorexia, bulimia, binge eating, and compulsive overeating. By listening you will get a good grasp on how an individual is affected by this disorder and also ways to prevent it. Hopefully after hearing her speech you will know everything about eating disorders. She is also a student here at Chaparral High School and is one of my good friends. I am honored to introduce to you Kelsey Hill.
Hello, I'm Kelsey and I will be discussing eating disorders with everyone. An eating disorder is any range of psychological disorders characterized by an abnormal or disturbed eating habits. They have the highest mortality rate of any mental illness. It is a problem in America. 8 billion people are diagnosed with an eating disorder. 7 million men and 7 million women and 1 million men. Also, nearly half of Americans personally know someone with an eating disorder. There are many different types and also many treatments to help overcome an eating disorder. SomethingFishy.org gave me a list of eating disorders. These were anorexia, bulimia, binge eating, and compulsive overeating. Thanks to web4health.info, I got definitions for each of these things. Bulimia is at first a person eats quickly and excessively. Then they vomit, start fasting, or exercising, even taking laxatives or medicines in order to avoid an increase of weight. Anorexia is where a person doesn't eat enough to maintain their normal weight. This usually happens because they are afraid of becoming fat and concerned about their figure. Binge eating is someone who eats too much in periods as a consequence of craving for food which exceeds their real nutritional needs. And compulsive overeating is when someone eats past the point of being comfortably full. They usually eat when they are not hungry. The symptoms and signs for anorexia and bulimia are usually the same. They consist of unusually eating, dramatic weight loss, low blood pressure, and depression, and seem to be obsessed with counting calories. The person would also have a tendency to work out constantly and unhealthily, have an unhealthy diet, and frequent trips to the bathrooms after a meal. Also, a person isolates themselves from a group while eating. They may be self-conscious of their disease and do not want people to notice that they may not be eating. Mood swings, loss of hair, and also loss of menstrual cycle can be signs of an eating disorder for anorexia or bulimia. The symptoms and signs of binge and compulsive eating are also the same as each other. The symptoms consist of fear of not being able to eat, as well as the fears when they start eating, they will not be able to stop. Leg and joint pain, excessive weight gain, and loss of sexual desire. High blood pressure, mood swings, and even depression. If someone has poor sleeping habits, they are not able to sleep well at night, they may have binge or compulsive eating disorder. Many things cause eating disorders. Some causes it is with kids in junior high. They may get made fun of and be called rude names. That leads them being self-conscious with themselves of how they look. They could go either way. They could start to starve themselves or eat to make themselves feel comfortable. Some kids, it's in high school. They want to fit in, look like girls in the magazines and in movies that are popular at school. That case is usually anorexia or bulimia. If they are in a relationship, some may feel like it's more attractive to look skinny. Also, adults can sometimes suffer with this problem. If they aren't getting along well, finding a job and/or spouse, that could lead to not eating healthy. If they are depressed, they could start eating a lot, or to impress, they could start eating less. Most causes, though, are with people that are in a particular sport that requires maintaining their weight. Cheerleading, ballet, gymnastics, and more are some of the problem. There are serious consequences with eating disorders. Some causes even lead to death. There are ways to overcome this disorder. There are therapy and treatment centers that specialize in eating disorders, and to get help is an easy process. The first step to help yourself is admit that you have a problem. Once you can admit there's a problem, you will be willing to fix the problem. Everyone has to love who they are and what they look like, be happy with themselves, and know what is right for their body and what isn't. Eating disorders can be very dangerous to come across. They have caused pain to thousands of people. Just because you aren't happy with your body does not mean you need to do bad things to it. If you think you're becoming overweight, don't starve yourself. Go on a healthy diet and start a proper workout. Your body is one of the only things that you have control over your life, especially as a teenager. So, you get to decide what goes in your body. Make the right choices of what you eat and what you're not going to eat. Don't get in bad habits and find yourself with an eating disorder. Now I would like to welcome everyone and introduce the speaker. She's going to talk to you about mental disorders. There are many different types, and she's going to explain a few. She will tell you what they are and what kind of treatment is possible for the disorder. After she gives you her speech, you should be completely informed about many mental disorders. Please help me welcome Caitlin Train.
I'm Caitlin Train, and I'm going to inform you about mental disorders. According to the National Institute of Mental Health, about 1 in 4 adults are diagnosed with a mental illness. That is approximately 57.7 million Americans that are experiencing issues with their mental health. Mental disorders are classified as conditions that disrupt a person's feelings, thinking process, their mood, and also their ability to function correctly during day-to-day tasks. A person of any race or age can attain at least one of these types of mental illnesses. The most common and most severe types of mental disorders include bipolar disorder, obsessive-compulsive disorder, also known as OCD, anxiety, borderline personality disorder, schizophrenia, and depression. Bipolar disorder, also known as manic depression illness, causes one to have unusual shifts in their mood, their energy, and their ability to carry out daily tasks. Bipolar disorder is a major mental illness. Results from having bipolar disorder are things that include suicide, bad relationships, and can soon begin to fall back in their schooling or careers. When looking for symptoms of bipolar disorder, you should look for certain things such as mood episodes. Or 1 minute, this person is overjoyed, and the next they're in a depressive, sad mood. Sometimes a person with this illness can experience these symptoms all at once, which is called a mixed state of emotions. Bipolar disorder cannot actually be treated, but a person can take certain treatments to settle their mood swings. This disorder is a long-term disorder, so the treatment is extensive over the course of a person's life. Another type of mental illness is anxiety disorder. There are many types of anxiety, such as obsessive-compulsive disorder, or OCD, post-traumatic stress disorder, and social phobia. Anxiety causes one to be filled with uncertainty and distress. Alcohol use or drug use can also help bring about the anxiety. OCD is a type of illness that makes a person have certain upsetting thoughts. With these thoughts, they become afraid or compulsive towards the thought. An example would be someone who is afraid of germs and has to repeatedly wash their hands over and over, or a person will repeatedly touch something or do a certain action, sometimes in a sequence. Post-traumatic stress comes from an event that happened to a person or someone they knew, usually bad events. People with this disorder usually lose feeling in things they enjoy or just become emotionally numb. None of these disorders are curable, but with a treatment, a person can get them controlled. Also, they can see a psychotherapist and attend regular therapy sessions. Borderline personality disorder is a serious illness that causes unstable mood swings, relationships, and behavior. With this disorder, people usually experience other types of mental illnesses such as depression or anxiety. Borderline personality disorder causes one not to have a clear self-image or usually just a change in opinions in what makes that person who they are. There are many dangerous symptoms of having borderline personality disorder: dangerous thoughts or behavior, thoughts of suicide or self-hurting attempts. Symptoms may show during childhood but are common in adolescents and adults. There are 3 types of psychotherapy treatments: cognitive behavioral therapy, dialectical behavioral therapy, and SEMA-focused therapy. Medications are also given to patients along with therapy sessions. Schizophrenia is another type of mental disorder. This is probably the most severe brain illness. Schizophrenia causes a person to hear voices or see things that aren't really there, like hallucinations. People who have schizophrenia sometimes just sit and stare without talking or moving. Also, what they speak may not make any sense. Some other symptoms are losing joy in daily activities, not talking at all throughout a day, no movement or facial expressions, and trouble with focusing. Men usually start seeing the symptoms in their late teens or early 20s. women usually start seeing their symptoms a little later in their 20s to 30s. According to the National Mental Health Institute, doctors don't exactly know the cause of schizophrenia, but it can be temporarily treated with medication. Depression is another illness that involves the brain that makes a person feel sad and interferes with daily life. A person with depression can get treatments of medication or therapy, although most people don't. Many times, people who have suffered heart attacks, strokes, or any serious disease go through depression. Symptoms of depression include persistent sadness, loss of energy, feelings of unworthiness, and thoughts of suicide. Depression doesn't just hurt you, it hurts the people around you. Mental disorders are a serious health issue that concern the brain, but this doesn't have anything to do with a person's intelligence. All of these disorders can be treated but not cured, and the treatments are extremely helpful. According to the World Health Organization, the best treatments reduce symptoms from 70 to 90% in most cases and improve life quality. Also, identifying the signs and symptoms early can help get them treated and start seeing a therapist or any type of treatment needed. Anxiety, personality disorder, schizophrenia, and depression are just some of the common mental health issues. Now I would like to welcome one last speaker. Today our speaker is going to talk to us about a career in the medical field. She will be explaining and giving details of the tasks of a neonatal nurse and how you become one. The speech can help you get a better understanding of just what a neonatal nurse is. I'm Caitlin Trent, and I would like to welcome Taylor Mathis. Hello, my name is Taylor Mathis. I will be informing you about the profession of a neonatal nurse. The purpose of this topic is to inform you of all there is to know about neonatal nurses. Neonatal nurses have many benefits and are very successful in what they do. By listening to my speech, you will leave here with the basic knowledge about neonatal nurses. Ever wonder what profession you will do when you get older? I may have one you can think about. In this big unwrapped world, there are many job opportunities available. There are many different professions a person can choose from. One major profession is in the medical field. Numerous jobs can be found when working in the medical field. A common nursing position that cares for newborn infants is called a neonatal nurse. The employee outlook for being a neonatal nurse is exceedingly good. By being a neonatal nurse, you will train to qualify, be put in a certain neonatal level, care for the newborn infants in that level, and last, make a good amount of money. Qualifications and training are necessary when becoming a neonatal nurse. By looking at the website www.bls.org, I was able to find the schooling required. You must first get your bachelor's degree in nursing, which would qualify you as a registered nurse or RN. The next step requires getting your certification in neonatal intensive care nursing or neonatal resuscitation. It would also be very essential if you had at least 3 years of clinical experience. After you complete the training at nursing school, you have to get certified by the State Nursing Board. Attaining a certification from the National Certification Corporation may also be beneficial. After you have all your training and certifications, you will be put into a certain level. There are 3 different levels of being a neonatal nurse. Level 1 cares for healthy newborns, while those in Level 2 care for ill or premature infants. Ones who care for newborns that are awfully ill and in the intensive care unit work in Level 3. These nurses take care of the babies in incubators and ventilators. Even though there are levels, all neonatal nurses care for infants. According to stateuniversity.com, neonatal nurses care for newborns for the first 28 days of the baby's lives, the children's most vulnerable stage. Not only do neonatal nurses focus on healthy babies, but they also care for premature and ill ones too. When caring for these newborn babies, they monitor their condition, check for signs of distress, and administer medication when essential. Neonatal nurses act as a support system for the family and parents of their newborn baby by changing their diapers and feeding them too. By doing all of this caring work, neonatal nurses make a fair amount of money. The average pay for a neonatal nurse is very good. It depends on an individual's experience and their education level. Entry-level nurses average about $59,040. while neonatal nurses with a few years of experience average about $76,000. Neonatal nurses with over 10 years of experience have a median annual salary of $92,607. Some even earn up to $111,831 per year. By considering everything a neonatal does and also their earnings, you may still have a tough time choosing this job. Finding a job that suits you in the medical field can be difficult. You can start by deciding on whether or not you like to care for infants, toddlers, young adults, or the elderly. In my case, I tremendously love to care for infants. They have always been that something special when I'm around them. This leads me to consider studying for the job position called a neonatal. There are many jobs a person can choose from. Professions in the medical field are very successful, including a neonatal profession. In the medical field, numerous jobs are offered. The nursing position I chose to inform you about cares for newborn infants. I chose to inform you about this job because I really love and always have loved to care for newborn babies. I have always considered doing this when I got older. If you were to consider this as well, remember you have to train to qualify, be put in a certain neonatal level, care for the newborn infants in that level, and last be rewarded with a good paycheck. Hopefully I have influenced a remarkable opinion for you on neonatal nurses and that maybe you will choose this profession too. Thank you.